There's more encouraging news for developing countries in the fight against the coronavirus. Pfizer has agreed to let other manufacturers make its experimental COVID-19 pill. Under the deal, more than half of the world's population could see generic versions of the treatment made available in their countries. Here in the U.S., nearly 59% of Americans are now fully vaccinated. The CDC reports more than 442 million doses of COVID-19 vaccines have been administered across the country. And now the focus is on getting children inoculated, something Dr. Anthony Fauci says is vital if families want to feel good about gathering for the holidays.
If you get vaccinated and your family's vaccinated, you can feel good about enjoying a typical Thanksgiving, Christmas with your family and close friends. There's no reason not to do that. This will end, Bill. We are not going to be going through this indefinitely. How quickly we get to the end depends on us. How well we vaccinate, how well we get boosted, and how well we do the kinds of things to protect ourselves.
Dr. Dyan Hes joins us now. She is the founder of Gramercy Pediatrics. And I presume, Dr. Hes, that you agree with what Dr. Fauci had to say. How are you advising your patients ahead of the holidays?
I think exactly the same thing. You know, if all the adults are vaccinated and all the kids 5 and up for sure now, I mean, that's what people were clamoring for when they were coming into the office. They're like, we just want to get at least one shot done before Thanksgiving. Now our biggest problem is the second shot is due over the Thanksgiving weekend, and we don't have any more supply, and we're waiting for the city to send some.
So, Dr. Hes, the White House top vaccination officials have said that children will need their first COVID-19 shot this week in order to be fully vaccinated by Christmas. So what are the dangers of kids not getting vaccinated ahead of the big family gatherings this year?
Listen, we've been through it already. It's going to be you get COVID, you're home for 10 days. And now I think for my biggest thing as a pediatrician is most schools, at least the public schools in New York, are not offering online school. So these schools they spent huge amount of money to have simultaneous in classroom and Zoom and online. And most school districts couldn't afford that anymore. So it's really, you have to be in school. So now if you're going to miss 10 days of school, you're going to miss 10 days of class as well. Like, they will send your homework home, but it's not the same thing as being there. And if you're in high school, that's a big deal. Also, your parents are going to have to stay home with you for 10 more days. I think people really can't ask for any more days off. I mean, we've stretched ourselves to the limit. So I think that's a big incentive to get your child vaccinated. That being said, you know, it's very state dependent, very local dependent, how their attitudes towards COVID.
According to the CDC, 3% of 28 million children under the age of 12 have received at least one shot of the COVID vaccine. But you mentioned that there has been a lot of enthusiasm at your practice. And did you just say, because you said it really quickly, are you out of the vaccine now for kids?
We're out of vaccine.
And if you are, then, so then what's the next step? When are you going to get a new shipment? Do you know any of that information?
No, I've been sending crazy amount of emails to the city, to the Department of Health, to Albany, because, I was supposed to wait for Thanksgiving, and I canceled my plans because it's more important for me to vaccinate the children in New York City. So I rehired all my staff, people who had off. We have to work. We have to give 100 vaccines on Friday. We have to give 100 vaccines on Saturday, and we're done. And I keep on emailing the city, and we got one cryptic response yesterday. How many do you need? We can't guarantee anything. And we did get an email from the city. They're not shipping anything next week, not even on Thanksgiving. They're not shipping any vaccine next week. So I need to get that vaccine this week so I can give those kids their second dose. Now, don't get me wrong. You don't have to come to my office for a second dose. You can go to, a big box pharmacy. But parents really liked coming to a pediatrics office. And many people made that choice, cognizant of the fact that they're going to a pediatrics office, and there have been mistakes at pharmacies. It is safe to get your vaccine at a pediatrician's office, especially if you're nervous with your child.
So where do you think the bottleneck is, doctor? I mean, the president has said that there are enough vaccines for people who want them. I note that specifically in New York City, everybody's eligible for a booster. I mean, adults are eligible for boosters as of yesterday. So there's going to be a little bit of pent-up demand for those shots. So what have you heard from Albany, from the city?
Nothing. We haven't heard anything. But what I think is what's happened in the past is that they cut out the pediatrician and they send it to the big box pharmacies because it's easier for them. So the most important thing is that you get your shot. So I don't care where you get it. I just want you to get it. And I know it's available at New York City pods all around the city. I'm sure in the country it's at all the CBSs and the Walgreens. So it's just about making your appointment. I just feel badly because we told these people that they have an appointment at my office on, the Friday and Saturday after Thanksgiving. And if I don't get it, we're going to be making hundreds of phone calls and people are going to be scrambling. And I think that's kind of where medicine has been going, is that they cut the doctor out of the picture and they just send everybody to these pharmacies or, institutions instead of a medical home.
Doctor, one of the things that this pandemic has put a spotlight on, and hopefully we will continue to talk about this even after the pandemic is gone, is, the racial inequalities in the healthcare system. Black people were more frequently dying of the disease. There were challenges in terms of getting people vaccinated, getting the vaccine to where they are, getting them if they're living in rural areas. And now we're seeing these gaps showing up when it comes to vaccinating children as well and the rollout. I'm wondering, when you look at these issues, what could be done to help address vaccine inequalities?
Well, New York City actually has the opposite. In the age 5 to 11, more Black and Hispanic children have been vaccinated than white children. And I think that's because our mayor has done a great job of getting these vans out. So we have mobile COVID vaccine vans that go into inner city communities. They are parked in front of schools, elementary schools, middle schools, really making it easy and accessible for families to go get their vaccine. And that's what they have to do all over the country. But we know that certain states really don't think the vaccine is that important. So they're not going to invest money of their own resources, having a van go out or, a visiting nurse go out into that community, into that rural community. And that's a sad part, that this is not a federal level health crisis. It's a very local, community-based health crisis, and you're just lucky if your system where you live prioritizes giving the vaccine. That's sad, but it's true.
All right, Dr. Dyan Hes, always great to see you, Doctor. Good luck in getting those vaccines and vaccinating those kids. We'll be rooting for you.
Thank you.
Thanks
Take
for joining
care.
us. You too.